My name is David Beecher, and I practice general dentistry in Benton, Iowa. Average day for me starts at about 8 o'clock, and I work till 1 o'clock, and from 1 to 2 is lunch, and from 2 till whenever we're done is quitting time. The first thing I do in the morning when I get there is I look through charts, see what I'm going to have to do during the day, sign some charts, do any last-minute lab work, and things like that. And we start seeing patients at about 8 o'clock, and treating patients depends on all the different things that they might need to have done, from routine fillings up to more complicated crown and bridge work. I check the hygienist, answer questions, guide people around, just stay busy all day long. I think one of the reasons that I became a dentist is so I could get into healthcare and help people, and also I can run my own practice, or basically pick my own hours and do the things that I want to do when I want to do them. There are several things that are difficult, and some of them have to do with even the best things, but dealing with people is probably one of the most difficult things, because people, you're not always sure what they want or what their expectations are, and you have to try and explain different things to them so that they can understand what it is. And even though you do your best efforts, sometimes people don't appreciate it, or it's not what they had in mind. Another thing is dealing with the business side of dentistry, where unfortunately we have to get paid for everything that we do, and sometimes it's difficult to get paid for things. People don't always pay their bills, do what they say they're going to do. Most dentists have to go through 4 years of undergraduate school, and concentrating on the sciences, physics, chemistry, and organic chemistry, and I guess that's the most difficult things that you have to do. Usually go through that in 4 years. Then you have to get accepted into dental school. You have to apply and be accepted in the school. Once you're accepted, then dental school consists of 4 years, and the first 2 years are mostly more classwork, and sometimes into the second year you get to do some patient treatments, and then the third and the fourth year basically revolve around patient treatments and learning how to do the different aspects of dentistry. Getting a license to practice dentistry amounts to taking some board tests. After your first 2 years, you do mostly bookwork, and after those first 2 years, then you have a written test over the bookwork that you did the first 2 years. And then after the second 2 years, or after your fourth year in dental school, you also have to take another written test on different aspects of dentistry, and also do a didactic test where you actually have to do some dental procedures. And it's a very difficult and trying time, because all the dental students are together at the same time, trying to use the same lab equipment, stumbling over each other, trying to be the first one to get a check. And if you're ahead of everyone else, it goes pretty smooth, and if something fails for you and you have to back up a step, then you're always waiting and you're afraid you're going to run out of time. So it's really challenging to get the license. Nowadays, I think the people that get into dentistry are focused on that from the very beginning, so they concentrate on their dental classes, the classes that they have to take to get into dental school. Have to get a high GPA, grade point average, and have to take a dental aptitude test that allows them to apply to dental school. And in my case, I tended to work my first 4 years of undergraduate, part-time job, and even 2 or 3 years into dental school as a part-time job. And I don't think today that you can probably afford the time away from your studies to do that type of thing. Today, I think it's almost impossible to start a practice from scratch, because you'd have to set up an office, find an office building, find all the equipment, or buy all the equipment that you need, hire staff, and it's just almost an overwhelming task. So today, most people either buy into a practice or work for another dentist until they work out some kind of deal where, you know, if the dentist is retiring or moving or something like that, then they would buy into all that stuff rather than trying to start from scratch. In my case, I don't really get called out very often. Usually I won't go to the office to meet somebody just for safety reasons unless they're people that I know pretty well. So if someone calls me, I just encourage them to go to the hospital emergency room, and then they'll usually get them through the night or the weekend, and then we'll see them during normal office hours the next day or the Monday or whatever. I think the outlook for dentistry is bright for young dentists in the future. There are a couple things that they have going for them that the way people's lifestyle is now that can keep them going for a long time. One has to do with more aesthetic dentistry. People are more concerned about their looks, and a lot of times they have more income that they can use for bleaching their teeth or cosmetic dentistry, different types of cosmetic dentistry that they don't necessarily have to do, but they want to do. And another thing that will keep dentists busy for a long time is the fact that people in general, and young people especially, have a constant diet of soda beverages, and the soda beverages have acid and sugar, and acid and sugar make cavities, and there's always cavities to take care of then. I think people would be interested in dentistry if they like to have a fairly good lifestyle where they have a fairly good income and they still have more or less regular office hours. The outlook for dentistry is bright. It looks like there's going to be a demand for some time, and even more of a demand maybe even in the future. If someone's thinking about going into a career in dentistry, I think they need to concentrate on 2 or 3 things. One of the things is they have to make sure that they like sciences and can keep their grades up and keep focused on what they want to do, because to get into dental school you have to do well on the aptitude test, and you have to have a high grade point, and then you have to be chosen to go or accepted to go to dental school. Another thing that people probably don't think about, but you have to be kind of a person that likes dealing with people and spending time with people, because that's what you're doing all day long, dealing with people. And probably the third thing that you need to be aware of is you just can't take off and leave every time you want to. You're tied to your practice. You have to be there for people when they want you to be there and expect you to be there. And so you can't just take off on any whim.
Thank you.